Hi, and thank you so much for joining us. My name is Courtney, and I work on the social media team here at Children's Hospital of Wisconsin. Today, I am joined by Dr. Bauer, a pediatrician here at one of our primary care clinics. Today, we're live broadcasting from Mount Pleasant Pediatrics. Our topic today revolves around one of the greatest times of year for many parents and families. It includes summer. We're going to talk about ways to stay safe and healthy this summer. Feel free to post your comments in the questions section of the broadcast, and we will get to those as time permits. So for starters, Dr. Bauer, can you tell me a little bit about yourself and what you do here at Children's Hospital of Wisconsin?
I'm a general pediatrician. I graduated from Medical College Wisconsin in 2002. I did my training in Northwest Chicago at Lutheran General Hospital. I actually worked in the Waterford area for about 8.5 years. I spent a year in Michigan more recently before returning to the Southeast Wisconsin area. I did urgent care for the past 7 months, and now I've joined the pediatrics group here in Mount Pleasant. So
great.
That's where we are.
Thank you. So I guess we'll jump right into things. First, we're going to talk a little bit about sunscreen. What can you tell me about the different SPF levels, anything that we would need to know about sunscreen and putting it on our children?
Sure. It's a very common question we get here about sunscreen. As far as strengths go, you'll see a lot of different strengths on the shelves at your local pharmacy. I generally go with SPF 30 through 50. That's my recommendation. As most of you know, the higher the number you see, the stronger, the more effective the sunblock's supposed to be. 15 I kind of shy away from because I feel like it's maybe good for an hour. It's not as effective. 30, 50 is what you'll see with a lot of the marketed baby sunblocks. I think those work the best. They should last you for a good couple hours. You may have to reapply, of course, if there's swimming going on or if there's a lot of sweating going on. I wouldn't recommend 100. I tried it once. It's like putting on paint. It just doesn't come off. It might be really effective, but I don't think you need to go any higher than 50.
So you're saying the higher number of sunscreen, the longer it stays on as well?
Well, it may stay on longer. Again, the 15s are kind of watery, so I do agree that there's probably a better chance it'll wash off pretty easily too.
And what happens if it gets into like a child's eyes or anywhere that it would?
Yeah, if it gets in your eyes, the best thing you can do is whatever you can see on the skin around it, try to wipe that off. If you have water or something that you can try to irrigate the eyes with, that's something you want to use. I'm sure the child won't like it too much, but that's what you have to do to limit the damage.
Great. And obviously sunscreen, we do our best to prevent sunburn.
Yep.
What happens, or what do you recommend if a child does get sunburned?
If a child does get sunburned, you may not notice it right away. A lot of people, when they get sunburned, they're going to leave the place that they were at and not realize it. They might, my skin looks a little pink, my child's skin looks a little pink, but you may not notice the full effect until hours later. If it's a really bad sunburn, you could probably expect that to show up right away. What you want to do is make sure that they are hydrated. That does help. If you want to give them pain medication, if it's that bad, you can try some Tylenol or Advil if it's appropriate. Some people will use aloe. You can use that to kind of cool the skin. The natural reaction also might be to put your arms or whatever body parts are burned into some cool water. That might help a little bit. And then depending on the severity of the sunburn, that'll give you an idea of how many days it may take to recuperate where it's not too bad for the child.
Keeping it hydrated is a good idea though.
Yeah, if you want to use a moisturizer, you can, provided it's not causing them pain putting it on their skin.
Great. Okay, so we were talking a little bit about pools. Do you have any water or pool safety tips for our fans?
Yeah, for pools, if you own a pool, the recommendation is to have all 4 sides of the pool surrounded at least by some type of fence. We recommend a 4-foot high fence and something with bars that don't let the kids sneak in, obviously. If the home is part of that surrounding fence, then you want to make sure that door is locked or has some type of alarm to it. As far as being around the pool, all kids should be observed. You want to make sure that no one's running around the pool. Most parents are going to be very good about telling them that, don't run around the pool. If they slip and trip, they might hit their head on the concrete, fall in if they're not, protected against drowning, that type of thing.
Life jackets, inner tubes.
Life jackets are a must for the younger kids who you are very sure cannot swim. Floaties, inflatable rafts, those aren't the best substitute, especially if you're in more of an open water surrounding. But there should always be someone around to watch who's at least familiar with CPR. Be familiar with CPR.
Okay, Great. What can you tell me about bee stings? How can we avoid them? They're awful when kids get stung.
Bee stings sometimes you can't avoid. Sometimes you just walk into those situations. That was my history as a kid. I walked into a couple of bee stings. I wasn't doing anything, but someone else was doing something. Things you can do to prevent it would be, of course, try to avoid places where you're going to find lots of bees. You know, if it's a garden and you see lots of bees there, don't go around it.
Okay.
Don't wear bright clothing, but probably better clothing that's got colors that resemble flowers. Some people, if they wear perfumed soaps or lotions, that might attract bees to them. And then if you have a bee around you, I don't recommend swatting at it. If it's getting right around your eye, you may have to react somehow, but try not to agitate the bees.
Okay. And is it pretty popular for kids to be allergic to bees, or how often would you say you see that?
I don't see a lot of kids allergic to bees, bee stings. It does happen. It's not very common. I would say it falls along the lines of mosquito bites. Everyone's going to react a little differently.
Okay.
Some people will get stung by a bee and they'll have a local reaction, and then every once in a blue moon you do get some kids who have more severe symptoms where their entire face puffs up, they might have shortness of breath. That's obviously more serious. I don't see a lot of that, thankfully.
And that's when you do go to the doctor, go to the ER?
If you're having that severity of symptoms, probably best to get emergent care, because you don't know, are those symptoms going to stop? Are they going to progress? Are they going to subside if you try some basic measures?
What can you tell me about bug spray? Is it safe to use on kids of all ages?
Bug spray is not, well, we'll start with mosquito repellent. That's not recommended at 2 months of age. You can use it over 2 months of age. A lot of parents might say, really, I can use that on my 5-month-old? Actually, you can. DEET, we usually don't go over 30%. DEET is a very effective ingredient, but it can be very irritating to the skin. You obviously don't want to spray it on your face. That's not a good idea. But we don't go over 30% because usually at that point you're not going to get much more benefit from it.
Okay.
You have to be careful putting it on with sunblock because it can actually lower how effective your sunblock is.
Okay.
And like I said, if you're going to put it on the skin, you probably want to avoid any places where you've got some open wounds. If you need to put it on the face, probably best to spray some on your hand and then rub it on the face as opposed to risking getting it in the eyes, because it can be very irritating.
Okay. Now, when you say DEET, is it common for like the brands that are on the shelf to have over 30%? Is that something we should be reading the label? Is it pretty labeled?
I don't see a lot of products over 30%. It is a good idea to look and see what your concentration is. Up to 30%, again, that should be the maximum benefit. It can be effective for up to 5 or 6 hours even.
Okay. Does bug spray prevent like ticks and other, is it just specific for mosquitoes?
Yes and no. Ticks are a pretty big concern during the summertime, and you can use DEET 30%, but what's usually more effective are going to be products that have an ingredient called permethrin. People might remember permethrin from treating other types of problems with infestations, but for ticks you can use that by spraying it on your clothes. We don't recommend putting it on your skin directly. Again, it can be very irritating and we don't recommend repeated use with it. But those types of products you can use. There can be some overlap. Otherwise, just avoiding areas where certain types of bugs and ticks are prevalent.
What about poison ivy? As we're kind of talking about outdoors and up north, I'm thinking.
Yeah, poison ivy, again, that's a situation where people are going to react differently. Some people will touch the poison ivy and nothing happens. Other people are very sensitive to poison ivy. Things you should know about poison ivy would be if there's any concern about you or your child being sensitive to it, know what poison ivy looks like. If you see poison ivy, just stay away from it. Poison sumac, another notorious one. A couple key things about poison ivy would be you do not spread it by scratching your skin. Once your skin has made contact with it, those are the areas that are typically going to be involved. And you can't give it to someone. So if you've got poison ivy, I can't scratch my arm, shake someone's hand, and give it to them. So those are a couple things that sometimes get misunderstood.
Okay. What can you tell me about bike safety? I know it's a popular one with the kids over the course of the summer. Obviously, you want to be all out on their bikes and riding around. Yeah,
you either want to be out riding your bikes, learning to ride a bike. You should wear your helmet. It's also important for parents to wear their helmets, show their kids that it's important for everybody to wear their helmets. If you're choosing a bike for a child, you want to make sure it's one where when they're sitting on it, they can get their feet to the ground. It's not recommended to buy a bike that they have to grow into. You can imagine if you've got a little kid up on this tall bike and they're off balance, how badly that could go. They should wear bright clothing so that they're visible on the road. They should know the rules of the road. And then if we have kids who are still learning, that might be a situation where elbow pads, knee pads might be a good idea. And of course, you want to have them learn in a place where it's safe. You don't want to have a bunch of cars around, traffic nearby. You want to make sure that when they're learning, they're not really afraid or in danger.
Yep. And if they fall and get a little scrape on their leg or scrape on their arm?
Biggest thing is take a look at it, make sure it's just a scrape. You want to make sure they don't have a broken bone, of course, but wash it with some soap and water. If it's a really big wound, you may have to bandage it. You may need to air it out periodically. Make sure over time there's no signs of infection.
Great. Well, thank you very much. So obviously it's been really warm the last couple of weeks here in Wisconsin. How do you know that a kid is well enough hydrated?
A couple things you can do to gauge that would be just, parents know how their kids eat and drink. If you don't feel like they've been drinking enough water, you can encourage them to drink fluids. Some people might say, is their urine clear? Is it dark yellow? That usually is a way of telling, are they hydrating enough? When they're outside, of course, things that would give you an idea of whether they're hydrated enough or whether they should drink some water would be things like, do they look tired? Have they been perspiring a lot? Are their lips dry? Those are some other clues you could use. And I think most parents are going to be mindful of that depending on, is it 70 degrees outside? Is it 90 degrees hot and humid? Those types of factors.
And is it okay for the kids to drink juice, or is it better for Gatorade and things with a lot of electrolytes for the time of year?
It depends on their exposure. It depends on the conditions. So let's say you're outside for like 10, 15 minutes and it's 80 degrees. Yeah, you can drink water. You can pretty much drink just about anything. When you start going over like an hour or two of activity outside and the conditions are really hot and humid, then you might say, let's make sure we're getting some electrolytes like Gatorade. You could do juice, and there are going to be some kids that are going to poo-poo some of these things anyway. They aren't going to want to drink them. So you just want to be ready. You want to have different fluids available for different situations.
Great. Okay, so let's talk a little bit about allergies. How can you tell if a child, has the itchy eyes or the runny nose or the sneezing in the summertime, whether it's allergies or the common cold?
Well, there's a lot of variables there too. If you have a really, really young child, let's say they're a year old, we don't see a lot of kids with seasonal environmental allergies. It usually takes a year or two to become sensitized to that. There's going to be exceptions. If there's a strong family history, for example, of allergies, that could make you lean more towards that. When you start having things like fever, that makes you start to think, no, this is probably more like a cold or some type of infection.
Okay.
But you can definitely have overlapping symptoms, and it can be tough for us to be sure what it is.
Great. I think the last thing that I wanted to touch on was stroller safety. Obviously, there's a lot of festivals and things going around here.
Sure.
As the weather gets nicer, what kind of types of tips can you tell us on strollers?
Well, some of the common things and some of the uncommon things that have been asked. How young can a child be in a stroller? Well, it really depends on what you're expecting to do with them. If it's just pushing them along for a nice leisurely walk, as long as the stroller has a nice wide base, it's not going to tip over. As long as you've checked the package, the product, to see what are the weight and age recommendations, it shouldn't be a problem. They should always use the harness, of course.
Right.
If they're at a stop, it's generally a good idea to make sure you've put the brakes on. If you're just stopping momentarily, that's different.
Pulling onto the stroller, it's okay.
And then one of the questions we don't usually get, but I've heard before, is what about jogging strollers? And you can actually use those 6 to 9 months of age. That's usually when we start saying it's okay to think about using those.
Cool. Awesome. Well, great. Well, thank you very much. Is there anything that you think I missed or anything that we should cover?
No, those are the big ones. I mean, we could spend all day talking about spider bites and rattlesnakes and a lot of other crazy stuff, but those are the big ones I would think about. The biggest thing for parents is whatever your plans are, know what the weather is, think ahead as far as what kind of equipment, safety concerns you should take into account.
Definitely. Well, thank you very much for your time, and thank you, Facebook fans, for joining in. We look forward to listening and tuning in next time.